Hey, hi everyone. My name is Max. I'm over here, and I am with May today. It's been a pleasure seeing everyone during the in the campus. Again, my name is Max. I am with May. Say hi, May.
Hi everyone, nice to meet you guys again through
Okay,
the video.
so we are here to discuss our new treatment in the cardiovascular care. The name of the treatment is called the heart pathway. If you notice, the heart is spelled capitalized, and it's intended that way so they can differentiate this treatment from the heart circulation. Again, the name of our treatment care is called the heart pathway. I will pass the mic to May so she can go ahead and introduce to you what the heart pathway means. Go ahead, May.
Next slide, please. Okay, about 10 million patients in the country present with chest pain in an emergency room annually. Here in the United States, when a patient presents with chest pain in the emergency room, they will receive a serious cardiac enzyme testing, stress testing, and cardiac angiography at the cost is about like 10 to 13 billion annually. Unfortunately, less than 10% of these patients are actually having acute coronary syndrome. The problem with numerous patients presenting in the emergency room with chest pain gave way to the introduction of the heart pathway in the United States. It is an application currently being in place on the various electronic health records like Epic, Corner, and other EMR that guide providers through a series of questions that by using the algorithm calculate the level of the cardiac risk. That information can help the provider to determine whether a patient should be discharged or need to be kept for more observation. And next slide, please. Okay, here's the figure one. The heart pathway is a diagnostic protocol used to stratify the risk of the patient complaining of chest pain, increase the efficiency of the evaluation, and significantly reduce objective cardiac testing costs. The heart pathway combines the heart score with cardiac troponin testing at the baseline, like 0 hour. That is the mean at the time when the patient presents to the emergency room at that time, and also 3 hours after. So we see from figure one how the heart pathway go. How the people based on the heart pathway to calculate the risk score. Okay. Next slide, please. Next slide for the figure two. Do you see? Next slide. There you go. So here's the figure two. How you calculate the score, and based on history, EKG, the person age, and also the patient's risk factors, and also the troponin level at 0 and 3 hours. So based on the score, and I'm going to tell you next steps. How do they based on the score to stratify the risk. The heart score included history in ECG, EKG, age, and risk factors. And the patient considered low risk if his heart score from 0 to 3 and the troponin level is below the upper reference limits. These are the patients that can be discharged safely if they below 0 to 3 the score 0 to 3, and also the troponin level is negative. If the patient have a heart score greater than 4 and troponin levels above the upper reference limits, despite his heart score, he will be considered as risk and need to be admitted to the hospital for further testings. Next slide, please. The heart pathway is indicated for provider. Is indicated for the provider in the emergency room, confirmed with patient presenting with chest pain to classify the risk earlier for the patient who have acute chest pain and identify the patient who can be discharged safely without further cardiac workup such as stress testing or coronary angiography. When a patient complains of chest pain, the attending physician in the emergency room will stratify the risk through the heart pathway using the heart score and series the troponin measurement at the baseline and at 3 hours. To calculate the heart score, the physician will use the patient's EKG and the study worksheet at the bedside. The physician then stratifies the patient's risk as low risk or at risk according to heart score and troponin level. Max, it's your turn.
Okay, so let me tell you about the research result from clinical trials regarding the heart pathway. During our cardiac convention, I believe they mentioned that some medications or even treatment plans started in Europe. We let it get tested there, and once everything came back okay, then we start implementing them here in the United States. Same thing happens with the heart pathway. It started in Europe, specifically the Netherlands. We let them use this application first before it got momentum here in the country. So the heart pathway got momentum in the country after a randomized clinical trial was conducted by Dr. Mahler and his group using patients and emergency room here in the United States. And to add, it was conducted somewhere in North Carolina. Okay, so the study randomized 282 patients, and they split it between 50-50 between treatment and control group, who presented in the emergency room with signs and symptoms suggestive of acute coronary care syndrome. The intervention used in the study was the heart score plus the troponin testing done at baseline and after 3 hours. So the study concluded that the heart pathway significantly shortens the patient's hospital stay. They were able to safely and early discharge the patient and reduced objective testing over 30 days. Next slide. So the randomized control trial study was followed by another study by Dr. Mahler, but this time they used the high sensitivity troponin. I believe that during our cardiac convention in school, we did heard about this high sensitivity troponin. Okay, so again, the randomized control trial study was followed by a secondary analysis study by Dr. Mahler comparing the contemporary cardiac troponin versus the high sensitivity troponin. And the study concluded that there were no significant difference with either troponin use, either the contemporary or the high sensitivity troponin in the heart pathway, with both troponin achieve 100% sensitivity and negative predicted value. Okay, next slide. Okay, regarding adverse reaction to the heart pathway, there were no adverse reaction reported from the randomized control trial conducted by Dr. Mahler and his group, as no patients in the trial appeared in the Social Security death master file. Major cardiac events, or MACE, were low, 10% of the participants, or 10 patients from the participants, and they are patients who were non-adherent in their treatment plan. Again, the randomized control trial was followed by a secondary analysis that yields the same conclusion, which is no adverse reaction or low MACE or major cardiac events. Okay, next slide. Okay, regarding the ethical issue, according to Resnick, studies conducted on human subjects like the heart pathway should address ethical issues such as informed consent, minimizing risk, protecting privacy, and confidentiality. And all of these were addressed in both the randomized control trial and secondary control or secondary analysis of the heart pathway done by Dr. Mahler and his group in 2015 and 2017. So again, the heart pathway is an application currently being placed in various electronic health records or EHR such as Epic, Cerner, and other EMR that guides provider through a series of questions that, by using a proper algorithm, calculates the patient's level of cardiac risk. That information can help providers check whether a patient can be discharged early or needs to be kept for observation, or patient needs to be admitted to the hospital for further testing. Again, the heart pathway is available as a cell phone app that providers can use at work and free to download in the Apple Store. I think that concludes our presentation. Do you have anything else to add, May?
No, well, I think we do well, right? So, yeah. Thank you, Max.
Okay, so if you have okay, if you have any question, feel free to email me or May, and we will be happy to assist you. And again, start using.
Discussion forum. So when we post in a discussion forums and have any question about presentation, we welcome you guys. You put a question, and then we'll feel free to put a question, and then we will answer you at our best. Okay.
Okay, and start using the heart pathway. Thanks, everyone.
Thanks.